News 4's Reopening Nashville Town Hall starts now.
And good evening, and thank you for joining us for this News 4 Reopening Nashville Town Hall special. Tonight, we're getting your questions answered about getting Music City up and running right again. I'm Tom Randalls.
And I am Tracy Cornett. Many of you have sent in your questions, but there is still time to submit a question through our WSMV Facebook page or through Twitter.
All right, we're a bit continuing to follow our social distancing guidelines, but Nashville Mayor John Cooper and, of course, Dr. Alex Jahangir are here to actually answer all your questions. Make sure everyone starts with a basic understanding of the Nashville reopening plan as laid out by Mayor Cooper. News 4's Nancy Amon shows us.
If all goes well, in about 2 weeks, the streets of Nashville will begin to look a little less empty. In Phase 1, we work from home if possible. Everyone wears a mask in public. Restaurants, bars serving food, and businesses will open at half capacity. Employees are screened daily and wear masks. There's no live music. In Phase 2, restaurants and businesses increase to three-quarter capacity. Nail salons, hair salons, businesses like that open by appointment only, 10 customers max. Gatherings of up to 50 people like weddings and religious services are okay. Playgrounds, tennis, and basketball courts can open with social distancing. In Phase 3, K through 12 schools open. Gatherings of up to 100 are okay. Restaurants and retail are at 100% capacity, and for the first time, live music is permitted in restaurants and bars. Bars can open at 50% capacity. Gyms and fitness centers open, but employees are screened daily and wear masks. Phase 4, bars and entertainment venues open at full capacity. Sports and large event venues open, but employees are screened daily.
But it's your efforts that will largely determine the end of the safer at home order.
How long between each phase? We only move to the next phase if we keep having fewer cases over a 14-day period. Any increase in active cases, we go back a step.
If something worrisome presents in these metrics, we will slow the process down.
Nancy Amons, News 4 Nashville.
Now, the biggest question we've had, Mr. Mayor, from folks is, do you have any indication as to when Phase 1 might start?
Well, as we've been talking, we expect it soon in the next days or weeks. I think it's important for your viewers to know, as hard as it is, the longer we can wait, all the epidemiologists tell us that we'll have a better outcome. We will control the disease better and be able to get through the phases more quickly and get to things like school reopening in the fall that we really need to do that and do that right. So weirdly, every day that we delay, though it seems painful, actually does lower the direction of the disease and will allow a better, smoother reentry sooner.
Okay, with the widespread and expanded testing, of course, we expect to see more confirmed cases, but is there any sort of date that you might have in mind that Nashville will reopen regardless of the testing data?
Well, we've always been saying we're hoping to do it in early May, every day. Now, today was a very good day. We had under 30 cases. If that were to continue in the next couple of days, I think we would be able to get to it sooner. The reality is we need a few days of notice before restaurants can begin to hire people back. So I'm expecting by early next week that you'll have a very clear date about when we would expect a Phase 1 reopening. Now, healthcare has already begun a soft reopening. And this is good to get some things on the way so that we can feel the effect of the disease in the community as we slowly do a phased soft reopening.
So what about enforcement? A lot of folks want to know about that. You know, it's the system that we have in place for enforcement. You want to add anything to that?
No, people have been great. People have been great. Enforcement is really education. It's people understanding how to do it safely. And I think people understand we're going to have the coronavirus with us for a long time until there's a vaccine. So we have to learn how to live with that. I think the Public Health Department has been on over 400 calls. Those are primarily education calls. There's been marvelous compliance across the county. People understand the importance of keeping each other safe. And if an employee or a customer calls, that's an education moment. And I just welcome everybody to kind of embrace it and say, let's work this out. Where should we stand? Right. Should I wear a mask? What do I do with my hands? How do I avoid touching each other? We're in this for the long run. We're in this for the long run, and let's use our public health department as a coach to get us through it.
You might want to loosen your tie on this next question,
okay.
Mr. Mayor.
Yes, sir.
Another big
Yes,
topic
Tom.
of discussion right now, the property tax increase.
Oh, boy. Okay.
In fact, within the last couple of hours, the owner of Peg Leg Porker posted an open letter to you, Mr. Mayor.
Okay.
I'm summarizing here, but he said when he started Peg Leg Porker back in 2013, property tax started out at about $4,600. This year, about $55,000, and after the property tax hike, he's talking 72 grand.
Yeah.
A lot of folks are asking, can we really survive this?
Yeah. Well, it's devastating. It's terrible. It's awful. Nobody would do it unless it was absolutely necessary. Ultimately, we have to do it because this is how cities operate. Now, what we are in control of locally is the property tax rate. And the property tax rate, even though we've proposed an enormous increase, I don't want to back away or tell you that it's not enormous. It's enormous. It is still lower than the property tax rate was 5 years ago and lower than our 25-year average. And Nashville has never been a high-tax town, and so it is an adjustment up. It still will be lower than the other 4 cities in Tennessee. And in the meantime, we're missing close to $500 million worth of revenue. It's frankly impressive that we were able to do it just at this rate increase if we're not going to have mass layoffs of employees. In the meantime, we need a city that gets us back to work. I'm hoping next week to say we're going to be back to work. We're going to need a platform of public service employees ready to go at that moment. It's devastating, it's unfortunate, but it is necessary.
Thank you, Mr. Mayor. Right now, let's head over to Tracy Cornett, who has a viewer-submitted question. Tracy?
Well, as you said there, Tom, this is a big deal. The property tax hike drawing a lot of questions, especially for those who are still recovering from the March tornadoes. So with our next question, here is Charlene.
Hi, Mayor Cooper. This is Charlene Oliver, co-executive director of the Equity Alliance. My question to you is this. Black residents feel as though we don't get much for our tax dollars. We pay taxes, but our neighborhoods are the most neglected, particularly in North Nashville. Our neighborhoods, they don't look like Green Hills. Since property taxes will be increased in next year's budget, what will you do as mayor to gain the trust of Black taxpayers and ensure better benefits in our neck of the woods?
Charlene, fantastic question. This is a long-term problem in Nashville. Let's not shy away from that our tax money has not necessarily been equitably spent across neighborhoods, across the whole community. The trick going forward is to spend the money that benefits all neighborhoods and residents, and that's particularly going to mean education. One of the triumphs of this budget, frankly, is that education is kept flat, even though their sales tax money going to education has been cut by maybe $100 million over the next 2 years. We are keeping it flat. The need to invest in education is great, and that's really our most effective social program. It's with education that we're going to advance our community and raise our standard of living for all people, and that's going to be happening on the other end of this virus. The virus is going to change everything in America, and we're going to double down and be a greater city because of it. And we're going to do it by prioritizing everybody and every neighborhood.
All right, Mr. Mayor, thank you so much. We are going to switch gears right now and do something a little different. We also want to talk about the virus itself. As of today, the city is reporting 2,612 confirmed cases, 1,328 recovered, 24 deaths, which brings us to a question for Dr. Jahangir. Now, one thing we've noticed is compared to other states, Tennessee appears to have a much lower death rate than other states with similar numbers of confirmed cases. For example, North Carolina has about the same amount of confirmed cases, but nearly double the deaths. Do we know why that might be?
Thanks, Tom. Part of it is we're recognizing that we're actually maybe perhaps a little lucky. There may be a little luck to this, but also I think a higher percentage of our people who have this virus are the younger group, so between the ages of 20 to 40. About a half of our population size is within that group. Furthermore, I think we have some great health systems, and I know that the major health systems in our community have been able to perhaps do new treatments and so forth that may be saving this life. But in all sincerity, I still think we need to recognize that there may be a little luck, but I think people are being vigilant and getting the care they need maybe sooner than before.
All right. Thank you so much. All right, Dr. Jahangir, we've also received a lot of questions about testing for people who aren't showing any symptoms. Do you think people should go ahead and get tested?
Sure. So I think if you're worried about this virus, you should get tested. And I understand if you do get tested, you need to self-isolate and wait for the results. So if you have any concern, though, whether it's the symptoms that everyone knows from fever, cough, shortness of breath, or loss of smell, or even in close contact with anyone, if you are worried about the virus, just get it figured out and get a test.
Can you also talk a little bit about the antibody test? Is it effective in helping some of those asymptomatic people find out if they've already actually had the illness?
You know, I think antibody test is really going to be the future of knowing when we can open up in much broader things. The challenge with antibody tests right now is there are hundreds of companies that are selling antibody tests, and there hasn't been much regulation or verification of the test. And so what I worry is we don't really know what an antibody test means. Does it mean you have immunity to COVID-19? Does it mean you have enough antibodies that maybe keep you from getting reinfected? So antibody tests are definitely the right way to go. I don't think we as a society are there right now with the right tests to do.
Thank you, Dr. Jahangir. Our next question is about masks. Now, we've had several people asking to clarify this, Mr. Mayor. The roadmap to reopening mentions wearing masks in public. Mayor Cooper, can you clarify if the general public will be required to wear these?
Well, recommended, urged, required, yes, from time to time. I mean, it's not going to, people, I think there's going to be a level of social pressure on people. I think we all feel it right now. That if you go out, wear a mask, be respectful of your neighbors. Don't be a vector. Do whatever you can. In the year ahead, it's going to require us to be closer to each other than probably public health would like us to be. In those circumstances, wear a mask.
Keep it handy. All right, Mr. Mayor, thanks so much. Let's toss things over to my colleague, Tracy Cornett.
All right, consumer investigator Lindsey Bramson tonight has our next question. This one is from Mayor Cooper.
Hi, Mayor Cooper. We're getting a lot of questions from Phase 2 businesses asking for the reasoning behind why they're a Phase 2, especially when many are small and locally owned. Can you help explain how you separated the types of businesses?
Thank you. If you're small and owned, my heart, of course, that's the type of business that has built America, but it doesn't have to do anything to do with you're essential or not essential. Essential and non-essential is just what that means, is do you need it for the rest of society to go on? So obviously food, healthcare ends up being a higher priority. The effort has been to reduce the clustering, the amount of social contact that we have, and that's a lot of what's behind essential and non-essential. If you have to do it, you have to do it, but otherwise try to stay safe, particularly in the early phases. We're trying to put just a dramatic stop to the disease. Well, it's been fairly effective.
Right, I was going to say, Mr. Mayor, is there any talk with the task force considering maybe additional measures for the Phase 2 businesses to allow them to open a little bit sooner?
Well, the thing I do want to encourage every business in Davidson County is to contact the public health department and have them come and walk through with you what the protocols will be for you to reopen and reopen safely. Walk it through with us, get a consultation. Help us understand the needs behind your business in keeping everybody safe. Now, we have to have a 360 view. It's not only the owners, it is also the employees, it is also the customers. Everybody needs to be safe. We understand the owners aren't, this is the worst recession probably in my lifetime, certainly the sharpest. This is a terrible time for all business. We want you to get back to work, but first step is if you've got a question, contact public health, get a consultation, and let's walk through how you manage your business safely.
This next question voicing the conflict a lot of folks are feeling right now. Here's what one viewer wrote. My employer is in Davidson County and has opened requesting all employees to return to work. Am I required to return to work despite the mayor's stay-at-home order?
Well, so if I'm understanding this, the business is in Davidson County, but the individual does not live in Davidson County. That's going to be up between the employee and their employer. Now, if they're reopening in Davidson County, right now they're essential. And so there was really no reason for them not to be back at work if they were already an essential business. Now, as we roll through the phases, we will continue to have some businesses at reduced capacity. And that's going to be a matter between the employer and the employee who needs to come into work in a reduced service environment.
Are there any safeguards in place, though, for folks who want to continue to work from home or who do not feel comfortable returning? Can they actually file for unemployment or maybe other assistance?
Yes. And again, I would urge people to contact my office. The unemployment compensation rules are broader than they used to be. And they do include categories that used not to be covered, such as gig economy workers. That's important for everybody to understand because Nashville depends on our gig economy workers too.
Thank you so much, Mr. Mayor. Let's head back over to Tracy Cornett again.
All right, this next question comes from John, and it addresses our senior community.
Mayor Cooper, thanks for letting me ask the question. All phases of the reopening plan stress that those of us aged 65 and over should remain at home. When do you think the city will open up for us? A lot of us are still active and involved in the community. Thank you.
And we're actually going to send this to Dr. Jahangir. Okay. What advice do you have for folks in that higher risk community when it comes to things like resuming daily activities and especially visiting family?
Yes, this is a really critical question because this virus impacts those who are older more than anyone else. If you look at all the deaths in Davidson County that are in our senior citizens, if you look at if you look at who gets hospitalized more likely, it's in our seniors. So my advice to those individuals are stay at home if possible, use social distancing, but more so than just for those individuals is their family members and friends. The reason it matters that your 20 or 30-year-old grandchild or your kid stays at home and social distances is because they're the vector. I don't worry per se as much of me getting a disease, but I do worry if I were to get it and were to give it to my grandmother, it would more likely not result in a fatality. So I guess the key is social distance, wash your hands if you're or one of our seniors, but more importantly for your family members and friends, you have to think about your loved ones that are older and use off-care there.
Thank you. News 4's Carly Gordon has been covering concerns and issues facing parents and families throughout the Safer at Home order. She has our next question, and it's for the mayor.
Lots of families had plans for summer camps and spending time at neighborhood and city pools, and they've reached out to me wanting to know, where did those activities fall in the roadmap to reopening?
Well, thank you, Carly. We hope we can get through the phases so that some of the summer can be preserved for everybody, parents and children. The trick will be to effectively go through the early phases to where we can, again, get to a place where we can live with the pandemic. I can't tell you exactly when, but I do know if we're more thorough and careful about the phased reopening, the likelihood of getting to phase 2 and phase 3 activities goes way up.
You know, the pandemic has also put a strain on people's mental health. This question for Dr. Jahangir. What advice do you have for people who've spent a lot of time inside, might be facing anxiety about going out in public again?
Yeah, mental health is a really important concern for us and as part of this task force. I think what is important is know that there's help. There's people out there who want to support you. Reach out to community resources. Talk to someone if you're worried. And if you're worried about domestic violence or other stress results, things that may result from stress, I'd recommend you reach out and get help and know that you're not alone.
So, Mayor Cooper, has there been actually any consideration to assisting businesses that acquire face masks, gloves, hand sanitizer, thermometers at a cost that will actually make it more financially feasible for all businesses? Well,
yes, and I think the state and us and the federal government are working towards that. We've let the state handle the big load in PPE equipment. Instead of every city competing with each other about finding PPE, the state and the Unified Command has tried to address that. And then we'll try to pass that on to businesses as it is available. The good news is we're in a lot better PPE situation than we were a month ago. And that PPE capacity is going to allow us, again, it's one of the guiding factors in where you can be reopened, is you have to have the equipment to do it.
And it also seems, just looking at the news stories from around the country, we're in a better PPE position than a lot of other cities, especially our size.
Well, we are. we are blessed by being a significant healthcare center with significant and capable healthcare providers, and they, I think, have helped get us through the early weeks as successfully as we have.
We do have a question from people whose driver's licenses or car registration is expiring in May. Are you actually considering extending grace periods for things like emissions testings, driver services? I know I spent a long time in line getting my real ID a few months back.
Yes, everything involving the city is, of course, extended. And this goes to things like evictions, too, right, that people need to know. Now, the driver's license is a state matter, so I don't want to speak, of course, for the state or for the governor on this, but if it's a local city action, we're going to delay it and make it possible for you the city is shut down, right? That's a pretty good excuse. This is a big snow day in a lot of ways.
A lot of folks out there, Mr. Mayor and Doctor, have been wondering, because you guys have been giving us these daily press briefings and you've been staying on top of all this information coming in. How do you do it? How do you keep going and press forward to make sure that you're on top of all the stuff you have to answer? You guys can answer this one at a time if you like.
Well, I'll go ahead. It's my pleasure and privilege to work with amazing people. I'm not only inspired by the citizens of Davidson County, I'm inspired by the people who are responding to this crisis. I want to thank Dr. Alex, who I never knew he had this gift for communication, but it's one of the pluses of the pandemic is that you see everybody's best side almost all the time, and it's inspiring.
Dr. Jahangir?
Thank you. It's an honor for me to be able to do this. I grew up in this city. I've raised my children here, and this impacts all of us. As I said, I have elderly parents and grandparents, and if I can give back to our city in this capacity, it's truly an honor to be able to serve.
Thank you so much, both of you. We have obviously heard a lot about problems at the state level with unemployment, Mr. Mayor. Have you had actually any conversations with the governor? And where do we stand on maybe improving the process to get people the money they so desperately need?
Well, the governor's been privileged to work with, and I know they are very concerned about this. They've been overwhelmed by the volume, and they are working as hard as they can. If you've been applying for unemployment, I know the state has been changing computer systems, adding capacity, adding more people, and responding. It is an incredible hardship, and everybody's trying to make it easier for people. And at the metro level, there are a lot of things such as contact tracing. We went from 2 to 3 people now to 85 people in almost just a matter of weeks, because you need to do that to get through the crisis. But in terms of unemployment, stay at it. I hear directly from people who are very frustrated that it is a state project with principally federal money, so you do have to make contact with the state in order to begin receiving those checks.
A question now for Dr. Alex Jahangir. What are we going to be able to learn about the immunity for people who've already had coronavirus? And in fact, do we actually know if people can get it or not?
And what we're learning is that we're still learning about it. I know there are a lot of studies, even here in town, of people taking plasma from people who've had it and learning from it. The question of whether you can get reinfected, honestly, I've read studies that say both things. So the question is somebody get reinfected, or does somebody have the virus that becomes dormant and reactivates? And that's the thing about this virus. This virus has never been in our world, ever. And so literally every day we're learning new things about it, and then this question around immunity is one that is still being examined.
Do you buy the theory that perhaps this virus has been around a little longer than the timeline that we've been given? Could it have actually been here in the winter of last year?
I do buy the theory that it probably was here sooner than we realized. I don't know how far back it goes, but I do think that's a very fair theory to believe.
All right. Well, Dr. Jahangir, we really appreciate everything that you've been doing. And for the patients with loved ones in a hospital, do you know if or when hospitals may begin relaxing some of those visitation policies and rules, especially with those people maybe having a baby for the first time or some important milestone like that?
I don't know that. I defer to our local health systems, but I know as a surgeon I do trauma surgery, it is hard, right? I see the pain in my family and my patients and not being able to have their family there. But it is really the best thing to keep the safety of both the patient, the employees of the hospital and the individuals who have family members in the hospital. So I don't know exactly when that will happen, but I know that's something to be taken very seriously. But this is the new normal we're in right now. And I think it's important for my fellow Nashvilleians to recognize that we will be in this new normal for as long as it takes to get a vaccine. And this may be one of these things that lasts a while.
Obviously, this has impacted so many people here in so many different ways. Kind of curious with both of you, talk about maybe if you would want to share what it's been like for your families behind the scenes, just trying to get through this, especially managing, you've got so much on your plates.
Well, I have a senior at home. So this is super hard. I have 3 teenagers. One is 20. We're all back home. It's a blessing to have everybody together at this time, but also it's super hard. I go home to a house where my high school senior reminds me every day that this is a terrible experience, and it is a terrible experience. But I'm grateful to my family for getting me through this, and it is, on the bright side, an opportunity for all families to spend quality time together, and let's embrace that. We have to, but let's embrace it.
Right. And when we look back on this, maybe, a year from now, and hopefully it'll be in a rearview mirror, hopefully we'll have a vaccine then. What do you hope to what will your takeaways be from having to manage a crisis like this for the city of Nashville?
I think we're going to come out stronger because we're going to understand how important we are to each other and the sacrifices that we're able to make, willing to make, not only pay higher property taxes, but look at our healthcare workers. Look at all these first responders. These are heroes. We're surrounded by heroes, and that's going to create the platform for having a better city, a greater city going forward.
Dr. Jahangir, we have a question for you right now, and it has to do with what the mayor just mentioned, and that's some of our healthcare professionals out there, the nurses and doctors on the front lines. You talk to a lot of them. How are they feeling? Can you give us a gauge of what they're going through right now and how they're managing this crisis?
I actually was practicing myself today. And what I love about my fellow healthcare workers is this is what we do. I see them every day. There's not one day when somebody's like, oh man, I can't believe we're doing this. This is what we do, and we do it with integrity and honor. And is it a little bit different? Is it perhaps a little bit more scary sometimes? Sure. But have I ever run across one person who is really regretting their decision in her healthcare? I have not yet met that person.
Wow. Thank you so much. Well, finally tonight, a question for Mayor Cooper. We have seen huge estimates on the financial toll that this pandemic has actually taken on our city. Do you, Mr. Mayor, have any estimate on how long it might take our city to recover financially? It's a loaded question, I understand.
Well, Nashville is, the final stage of Nashville is going to recover when the country recovers. That's the tough part of the news. Our business often is a national business, and we have to bring people here who feel safe. We have to be safe, but also have a reputation for being safe. That means the last little bit, the last little 10% probably won't come back for a year. So we have to be prepared for that. We don't want it. We want to do it quicker, but we have to make those plans.
Can you give me maybe the top 1 or 2 questions that you get maybe daily or weekly from some of the business owners, business leaders regarding this pandemic?
Well, I get encouragement from business leaders, and routinely they encourage me to do this right. Don't go too quickly. As painful as it is, it's better to do it right than have a redo. We don't want to backslide. We don't want to go back. We don't want to have to go through all this pain again, because unwittingly we created a second wave. Now, well, let's not do that. That's what I hear mostly. Don't create a second wave. Get this through in the phases first, and we'll get out of it on the other end sooner, and try to get back to 100% months ahead of what could happen if you're not super careful with this phase.
Are you worried about us backsliding?
I am worried about us backsliding. I'm worried that people are thinking with the news about getting restarted that it's over. It is not over. We have thousands of people who have the virus. We have thousands of people, frankly, who have the virus and don't know they have the virus, right? So you cannot relax. If there's something I want your viewers to realize, you have to stay at it. We're not out of this for a year until there's a vaccine. And social distancing is our tool for keeping us safe.
On those words, we are going to end. Thank you for joining us for News 4's Reopening Nashville Town Hall. If you missed any part of the program, you can watch it on our Facebook page and WSNB.com and our News 4 app. We'll see you back here at 10.